material which has cartilage-like properties and recruits stem cells to grow cartilage, and married it with this 3D printed structure. So you basically really amplify and enhance the effect of the low-cost implantable device.
Minimally invasive ASC, early intervention, and regenerative medicine.
I think the question relates to the animal study, the goat study. What was the duration until the animals were weight-bearing again?
So they were weight-bearing immediately.
Because that's pretty miraculous.
Do you like science? Is medicine your passion? Then I think the pitch is for you. My name is Robin Young. I was a medical technology analyst for 30 years. If you've never seen how medical breakthroughs get from the lab to the patient, I think you would be amazed and astonished. For me, it's the most thrilling experience you can imagine. So I invited a group of the most interesting medical breakthrough companies I know to pitch their science, their vision, their passion to 4 really smart and experienced investors, engineers, physicians, and consultants. These companies are small, but they are the real deal. Can you spot a future winner? If you like this video, please subscribe to our YouTube channel. Visit me at www.ryortho.com. But most of all, support the entrepreneurs you will meet on The Pitch. Thank you.
What if we had an off-the-shelf implant, something that would be capable of filling defects and regenerating tissue using the body's own stem cells without the need for expensive and complicated biological processing, culture expansion, identification, and manipulation of cells? Well, our final pitch for tonight is from Ben Holmes at Nanochon. And Ben thinks that he and his team have a solution that does just that. So let's watch the video from Nanochon.
It's a breakthrough scientifically because we've shown in multiple different studies that it recruits stem cells and regenerates cartilage. So you get the same sort of restorative effect of these really high-end cell therapies, but it's a low-cost implantable device. Our scientific interests were in designing these materials which behaved like tissues in the body, and then broadly speaking, using 3D printing. We've taken this material which has cartilage-like properties and recruits stem cells to grow cartilage, and married it with this 3D printed structure. So you basically really amplify and enhance the effect of interacting with the body. Nanochon's product is essentially a minimally invasive implant. It's a patch which can be rolled up, introduced into a patient's knee arthroscopically, and then used to fill in these traumatic or prearthritic lesions in the cartilage surface, which are the primary driver of osteoarthritis and eventually advanced joint disease. It's a fully synthetic, shelf-stable product, so something that can be packaged. The surgeon would buy some volume of the product and basically have it stored at their surgery center, something that they can use as needed. So really the only thing limiting their ability to treat the patient is just how fast can they schedule the procedure. We envision our device working with all of the exact same procedures and protocols that sports medicine surgeons are doing in terms of arthroscopic treatment. So it doesn't really require special training or special procedure in terms of accessing the knee. And that's really our vision for the product, that this is something that could really reach many, many more patients because of the ease of use, the lower cost. Basically using materials that mimic what's in the body and also 3D printing to basically get cells to grow new tissues. We talked to a ton of orthopedic surgeons, and that's how we sort of wound up focusing on this sports medicine application and basically doing earlier interventions on cartilage damage and cartilage loss in the knee. We met that huge pain point that they have of really needing a product that they want to commoditize, that they want to be able to buy and afford at a volume, but then easily use on their patients. This technology is so adaptable and so scalable. Certainly, I think treating small joints, potentially treating sufferers of rheumatoid arthritis, injuries of the spine, plastic surgery, craniofacial surgery. Really what I'm excited about is actually finally taking this out of the lab and actually working with a manufacturing partner, actually doing the FDA compliant testing, and really, as I said, getting ready to go into the clinic, to go into human patients. I mean, that's really what I'm excited about, and really seeing this thing turn into a clinically viable product. I'm going to be proud when I actually see this go into human patients. That has really stayed the motivator for us, is helping patients and helping surgeons treat patients in a better way.
Ben, that was fantastic. Very inspirational and exciting as an opportunity. Let's start with Tony and give him an opportunity to spend a couple of minutes with questions.
This is smart materials, number one, minimally invasive ASC, early intervention, and regenerative medicine. These are four of the areas that we look at to invest in, because this is our vision of the direction of the future of all healthcare innovation. Having said that, it sounds like you're very early in developing this technology. Has this technology been implanted in any animal model at this time?
Yes, we've done both small animal and large animal studies.
Okay, wonderful. So you're a little bit further than it sounded like. And in those studies, how do you hold the implant in place?
Yeah, so we've looked at a number of different fixation methods, and we've landed on fibrin glue.
Fibrin glue. Okay, good. Good. Thank you.
Thank you. Thank you, Tony. I'm happy to hear you ask technical questions. You can come and join me anytime. It's fantastic. Mike, on to you, please.
Tony took all my technical questions. I have to think of some others.
I'm sorry.
It's okay. So you said you did large and small animals, Ben. What's the large animal model that you've used?
It was a goat, and we did a 1 centimeter chondral lesion on the medial femoral condyle.
And were you able to track their mobility? I mean, did you have a score tracking for the mobility, or did you just watch them?
Yeah, so really this was more of a pilot. The evaluation focused on gross histology. We are, in our GLP animal studies, going to be evaluating pain and mobility and doing MRI.
Yeah, I mean, the question, I guess I was kind of focused on the fixation question, because I just wonder if fibrin glue, did you have any dislodgements of the device in that study at all?
Yeah, so we actually looked at different configurations, and we saw dislodgements of the non-3D printed implant. So, I mean, really, we confirmed that this 3D printed porosity does foster the rapid ingrowth that we thought it would. So we believe fibrin glue will be fine. And you know, our KOLs feel that, you know, that's standard of care. There's always a possibility that something like a single suture anchor might be used for a particularly large lesion. I think that's something that would be done at the discretion of the surgeon.
Yeah, it's amazing how easy it is to dislodge things, especially in the knee. Plenty of devices have been put in there, and keeping them in the right place is hard. Just pay attention to that issue as you go forward.
Thank you, Mike. Audrey, you're allowed to ask technical questions too.
Why, thank you. Ben, hi. Nice technology. Look forward to seeing where it goes. Can you tell us a little bit more about the novel material and your patent claims?
Yeah, so the material is a unique thermoplastic polymer, which I think is something that makes it unique in sort of the cartilage material engineering world. Our patents cover the material itself, as well as the 3D printed structure, alternative materials, alternative non-3D printing manufacturing techniques, and then also some future embodiments for different applications beyond cartilage resurfacing.
How long is someone going to have to be careful with this versus being able to go back to their normal activities?
Right. So certainly this is just a hypothesis, but you know, based on what we saw in the goats, we basically saw complete mature cartilage forming in 4 months, where 8 to 12 months is typical. So there's a real potential for reduced recovery time.
Thank you so much.
Thank you, Audrey. So, Ben, you may know that other companies in this space are taking a 3D printing approach that are trying to customize it to each patient and you're taking a sort of mass manufactured approach. Could you talk a little bit about your strategic decision around that?
Yeah, absolutely. I think that a big piece of that is because we are so focused on sports medicine as a first application. I think that um, customized knee implants might make sense for much more advanced lesions and sort of the later stage of advanced joint disease. But we've talked to almost, actually, I would say over 100 surgeons at this point, and the sports medicine surgeon does not care about a customized implant. It's actually kind of the opposite. They all said they wanted something that they had a volume of, and then also something that they could cut themselves. They didn't trust something that was customized. And yes, you can cut our device easily with surgical tools.
Terrific. And also on your website, importantly, you're highlighting the opportunity in veterinary care, whether it's large animal or companion animal, and now you've got human. So could you also comment on your strategy in thinking about how to sequence and prioritize those markets?
Absolutely. So we are planning for our GLP large animal study to do horses at Colorado State. So having that data will allow us to very quickly get FDA approval to do basically an equine veterinary product. Early on in the company's founding, we were looking at that market and decided not to focus on it. But if we generate some good horse data, I think there's some good distributors out there that we could potentially get a product out into that veterinary market without taking our focus away from the human study. So we don't ever plan on that being our core business, but I think there are opportunities for early revenue.
Terrific. I have a lot more technical questions, like do you put the fibrin glue underneath? Do you put the fibrin glue on top? Do you suture it down to an anchor underneath? Happy to talk about that stuff with you offline. So thank you. I think now we can turn to the audience and see what the audience thinks. Is Ben and his team, are they on to a game-changing approach, or should they go back to the drawing board with this technology? Well, you can see here that 80% think that you're either a game changer, going to change the standard, or at least it looks promising and you need more work. And I think it's probably fair to say that you yourself recognize it's very promising and you need more work. There's no substitute for data. No substitute for data at all. So let's turn to my friend Tony for any final comments or guidance.
Thank you, Scott. It sounds quite amazing that you've been able to accelerate cartilage growth from 8 months, 9 months down to 4 months. Is there a particular reason for that?
Well, we think a lot of that actually comes from the 3D printed structure. One of the general hypotheses about like using 3D printing to make a tissue matrix is that if you create these predictable, well-organized porosities, you get much better cell infusion and just in general interaction with the material and interaction with the biomechanical cues. So that's
proving that is really valuable to you.
Okay.
Something I'd think about. Keep going in this direction because the problem isn't solved yet and the need is really huge.
I really appreciate those comments and I appreciate you recognizing that. I mean, that's really what has been driving us forward is again, that we do feel that way, that there's an enormous need. Appreciate
Fantastic. It. Mike?
Look, I think that the challenge is generating great data here. The website has some elegant images of regenerated cartilage. And I mean, that's that and type of model, animal model, the activity. I would measure both cartilage and animal activity and return to full function. But generating data is what in the regulatory environment you're targeting is going to be of paramount importance as you go forward.
Terrific. Audrey?
Ben, I see you're in J Labs currently. Tell us a little bit about that, including what you've learned.
Yeah, I think for us, it's just been an opportunity to understand the perspective of one of the major strategics in the space. So getting to know both people at DePuy, MyTech, and kind of understand the how they think strategically about sports medicine, but also getting to really become visible to both JJDC and J&J Innovation as potential future funding partners.
Okay, thank you.
Terrific. Ben, there is a question that came in from the audience, as it were. Heather Baldwin asks, and I think the question relates to the animal study, the goat study. What was the duration until the animals were weight bearing again, and how did you correlate that to a clinical post-op protocol?
So they were weight bearing immediately. And, I think I would correlate that to patients. Obviously, you couldn't go out and play basketball after your surgery, but I think patients will be able to walk on this in some capacity.
Terrific. That's having done no small number of large animal studies, that's a pretty miraculous outcome. And I'll be interested to see the data as the data evolves, and wish you well. You're overcoming one of the significant challenges out there, which is dealing with these combination products, or products that are, if you break down, and our friends at MICRA all know this as well, but if you're going through CDRH, and you will, in essence, have one pivotal clinical trial. But if you were going through CBER because you had a biological component, like you had cells associated with that, you would have two pivotal clinical trials. So you're going to save a lot of time, headache, and money to increase the value for your investors. So with that, I wish you a hearty congratulations and the best of luck. I'd like to now put up the contact information for Ben and Nanochon. So if people would like to reach out to Ben and his growing team at Nanochon, this is how to do that. So I want to thank my co-panelists, Tony, Mike, and Audrey. Over and out. Thank you very much.
There's
I'm
Scott.
dressed. He's not on yet, is he? Is Tony here?
Yes, I'm on.
This
Oh
is
my goodness.
This is
Oh,
my
wow.
homage to you, good sir.
Oh my goodness.
Now, I'm going to tell you something else, though. Unlike you, I'm wearing shorts.